Today we'll be doing some shoulder views. The first one I'm going to be demonstrating is an AP neutral shoulder, and this would be for trauma. So in this we're going to be using a 10 by 12. I'm just going to go through with it since I can't do both. I'm going to go talk about it a little bit before I actually do the setup. So the patient presents, you could do a dangling arm, and that's to look for a fracture. And if the arm's bent at the elbow, that's more for a shoulder dislocation. So for neutral rotation, the central ray is going to be at the coracoid process and then use it to center it on the actual film. The patient will rest their palm, and it will be a 45-degree angle of the humerus. So when I'm going on here, it should be neutral. So what you're looking at is my palm should be flat. There's no internal or external rotation. It's at a neutral position with my central ray. Making sure that the coracoid process is in the center of the film, being in this projection where I should have it. The next we're going to be doing is the Grashy view, and this is going to have a 30-degree body rotation. So in this case, it's going to be an oblique view. My shoulder is leaning up against the bucky in this case, and I'm rotated at 30 degrees with the central ray going through right here. So in this case, it's 30 degrees oblique to accomplish the lateral glenohumeral joint in the viewing. And the body of the scapula, the patient's rotated obliquely following the curvature of the posterior ribs. Now for scapula Y, this is going to be a 60-degree body rotation. We do have a PA oblique for the scapula Y, and the lateral scapula shoulder or Y view is part of the standard shoulder views. It's a projection that we use for suspected dislocations, scapular fractures, and degenerative changes. It's also a really good view to see both the coracoid process and the acromion process. So for the PA, we have the patient is completely Now I know there is another view for Grashy's, but I think I'm just going to stick with the PA, having my central ray and making sure that the coracoid and acromion is in both the objects. And for all scapula views, we're going to be using a 10 by 12 cassette film. So I guess the P to A would be like that for the shoulder, for the Y scapula. Next, we're going to be doing the AP and AP tilt for the clavicle. Oh, for the one I did miss for the... No, that's only for lateral. Okay. Now, for my clavicle, it's going to be 12 by 10 instead of the 10 by 12. It'll stay. There we go. And for the AP clavicle, the central ray is going to be center of the clavicle and then use it to center the center of the film. And this one, they have, when they're going across, they have the patient actually looking away and distracting. There also is a PA clavicle that you can do. Knowing that the clavicle right here, so for this one I might have had to be a little bit lower just from how high this cassette that I'm using is. And the central ray is directly perpendicular to the middle of the clavicle through the center of the film. And this is only pretty much just getting a view of the clavicle. Now we're going to do, there is an AP tilt, and the only difference with the AP tilt is that there's going to be an actual tilt of 10 to 15 degrees. So the central ray, instead of going straight on, is going to be tilted up and coming up this way as a semi-axial. I can't really show the semi-axial in that view, but the patient is erect in the AP position, And the central ray is to the center of the clavicle, but at an angle of 15 to 20 degrees. And because of this view, the clavicle is actually free of superimposition by the ribs and the superior border of the scapula.